Hi guys, welcome back to my channel. Today I'm going to be doing a video on this new series that I'm going to create here on my channel called Sickle Cell Sunday. So I'm basically creating this little series so on Sundays I can sit down and chit chat with you guys about sickle cell and any new updates that I have, or basically keep you guys updated on how my sickle cell is going and things like that. I have been thinking for a while now, and I really want to keep raising awareness for sickle cell anemia or sickle cell disease. So I kind of wanted to create this little series, Sickle Cell Sunday, so I can basically sit down with you guys, chit chat, and let you guys know of the struggles that maybe I encountered that week, or any new updates or anything sickle cell related, because I really want to keep raising that awareness. And I feel like this will be the best way for me to communicate with you guys on what's kind of happening, and you guys can learn more of the struggles that sickle cell patients encounter, and maybe a little bit on how their lives are like. So I'm going to start off with a quick little update on how sickle cell has been treating me this winter. And so my blood levels have been very low this past month, and maybe since November, and we're now going into early January. My latest labs showed that my hemoglobin was around a 7, which is very low for anybody, let alone a sickle cell patient. So basically your energy is a lot lower, and I get a lot of pain. That's when crises can arise, and I have been in a lot of pain, and that's kind of how the labs turned out. My iron levels don't really get super high, so they're pretty good right now. They're relatively normal, and sometimes they even do get a little bit on the lower side because I am not on monthly transfusions like I used to be when I was in high school. I used to get almost monthly transfusions, and so now that I'm in college, they don't really want to keep doing that monthly transfusions because they don't want to create a dependency issue on those transfusions. And then they only want to do it when my blood levels are really low. So I did get a blood transfusion a couple of weeks ago, but still my blood levels are still pretty low. So back in November I had to do an MRI of my knee, and because I was having so much pain on my knee, I really couldn't even walk. My knee was also like swelling up, it was turning like red. It was weird. I've never had this pain before. It was such a new and different pain that it really had me concerned, and it was just weird because it almost felt like someone was tying a rope around my leg and then kind of pulling it tight, and I don't know, it was just such a weird pain that I have never felt in that area. So I called my doctor. I told her, I'm still having pain, and she decided to do an x-ray and an MRI. So the results of the MRI showed that I have AVN, which is short for avascular necrosis, which is basically where your bone starts dying. So with the lack of oxygen and the lack of blood flow to that part of the knee, the bone becomes dead. So my doctor sent me over to an orthopedic surgeon where we sat down and looked at the options. And so he basically said, and I'm reading this from my notes I have in my record, so it basically says that I have a septic necrosis of the right medial femoral condyle, which is the knee, and the only thing the doctor really suggested that we could do is a core decompression with bone marrow aspirate concentrate injection. So basically they're going to take some of my own bone marrow and they will inject that bone marrow to where the dead bone is in hopes of rejuvenating and reviving that dead bone. This is a relatively, I think it's a relatively new procedure, and some people say it's very risky. They also mentioned that they wouldn't be able to do this surgery if my knee were to collapse. So they're trying to work against time. Out of all this, sometimes I start doubting myself. I'm like, am I really having pain, or am I really encountering these symptoms? Because sometimes the doctors can be very rude and kind of harsh, and I feel like you almost have to battle it out with your doctor. And so for me, I was kind of like, I knew I had the pain, I just thought it was a simple crisis, and it turned out to be AVN, or avascular necrosis. So it really taught me a good lesson to really listen to your body, and if you're not feeling good, you know, really have a good dialogue with your doctor and explain your symptoms and advocate for yourself. I know it can be frustrating, but one of the best advices I can have for another sickle cell warrior is to really be actively involved in your healthcare, and you know, be proactive about situations. Ask them what you can do. Hey, can you know, get an x-ray, or can you check this out, I'm not feeling good. You know, give them suggestions, and you know, maybe you guys can work together to figure out what is going on with your body, because obviously we're having pain, and pain is not normal. But you know, living with sickle cell, we do become accustomed to certain pain, and we almost doubt ourselves, like, is this really an emergency? Is this really something to worry about? And I believe that you will know if it's something to worry about or not. In this case, this pain was totally different than my sickle cell pain crisis. It was very completely different than my other pains. And my knee, it was very strange, and till this day my knee is still slightly swollen. It wasn't as swollen as it was back then, but I'm still swollen in my knee, and it's very hard for me to like bend down or walk. I used to walk every day for like 30 minutes, and now I can't even do that anymore because it's really hurting me to walk. So that's basically what I've been dealing with these past couple of months. I've been dealing with pains, and then those finals were driving me nuts. So now I'm on vacation and I'm home and relaxing, and I can take it more easier. I've been relaxing a lot more, so the stress levels were really like affecting my sickle cell also. But now that I'm home, I can focus on, you know, keeping you guys updated, and I'm gonna try to keep you guys updated every week. Like I said, on Sunday I'll try to have a video out on my journey with sickle cell. Every week and every day is different for a sickle cell patient, but I'm gonna try my hardest to keep these sickle cell Sunday videos coming to you guys. And if there's anything you want to ask me about sickle cell or any other topics, please let me know so I can maybe answer those questions in my next Sickle Cell Sunday video. So anyways guys, that's it for this week's Sickle Cell Sunday video. Please let me know if you have any questions or comments on anything you may have seen in this video. Also, thank you so much for watching this video. I really appreciate that you guys take the time out of your day and watch my videos. Please be sure to check out my Facebook, Instagram, and Snapchat. I'm always on my social media, so if you have any further questions or comments or want to message me, please do so. And as always, I'll see you in the next video. Bye guys.